We all have weight loss goals this year. Maybe you do. I know I do. But when you're trying to stick with weight loss, there are some factors in there that may not match up with just simply cutting back on calories or exercising more. Hey, I want to bring in Dr. Matt Antonucci. He is with Neurologic Integrated Health in Mount Pleasant. Thanks so much for being on Port City Live.
Thanks for having me.
Yeah, so we want to talk about the thyroid gland. And metabolism, you know, a word that we think about as slowing down as you age, may be something that causes some problems for you along the line. But the thyroid, we need to get to the bottom of the thyroid, and this really comes into play when folks are trying to lose weight in this new year, New Year's resolution. How do they identify when maybe their thyroid may be behind their metabolism, not in sync with their body?
Right. Well, we have this little thing where we say what to do when workouts don't work out. So if you're going to the gym every day and you're working out and you're not seeing any results, you're not losing weight, you're still fatigued, and you're just having a really hard time, there's a good possibility that you might have a thyroid issue. So, you know, one of the ways to identify that is based on the symptoms. So, you know, if you're tired, fatigued, have cold hands, cold feet, you know, thin hair, your eyebrows thin a little bit, that's a sign of hypothyroidism, and, you know, basically slows down your metabolism, makes it virtually impossible to lose weight.
Now, this is not something to mess around with because we read about this all the time. Some folks do a lot of research on it and figure, oh, yes, I must have a thyroid problem because I'm not able to lose weight. Not necessarily the case, and you have to be cautious in that particular case.
Right, exactly.
There is a lot of abuse of thyroid medication out there as well, which we should mention because this is when you make the decision, the conscious decision, to go see a doctor.
Right, exactly. Well, thyroid medication is a little bit overused in my opinion, but there's a time and a place for it always. There's also a time and a place for hormone replacement therapy. But a lot of times what happens is the thyroid is actually working perfectly fine. It's the rest of the body that's not really working that well. Your thyroid responds to your environment, internal and external, in order to make appropriate changes. So if you're eating coffee and bagels all day long and you're stressed out, your thyroid is going to respond to that and slow you down before you burn out. You know, it's a protective mechanism. And a lot of times it's our environment and our lifestyles that are really the problem, and the thyroid is just showing the symptoms of it. So it's really important to identify those kind of things, and also to get adequate blood work, you know, blood tests done. And that's something that's really important in diagnosing thyroid.
And there's a condition that you talk about that 1 in 10 women has. They're walking around with it, don't even know it.
Right. It's called Hashimoto's thyroiditis. It's an autoimmune thyroid disorder. And 1 in 10 women have it. That's what the literature is actually showing us. And, you know, that's not even a problem with the thyroid or the body. It's a problem with the immune system. Well, I guess it's still part of the body, but it's a problem with the immune system, and that needs to be treated totally different. When you do lab tests on a Hashimoto's patient, it's going to look like they have a thyroid problem until you really investigate into the immune system and you say, aha, that's the problem, the immune system, not the thyroid.
Okay, so there are many challenges out there when it comes to weight loss, as we all know. These are just a few more that you might consider, and it might be a reason to investigate further with a qualified physician. Dr. Matt Antonucci is a chiropractor in Mount Pleasant. Your background is a little bit different than your typical chiropractor.
Right.
Explain that to me.
I'm actually a board-certified chiropractic neurologist. So you go to chiropractic school, and after that you can take another program, which is either 2 to 4 years, and you sit for a board examination. And you know, not very many chiropractors in the world actually are chiropractic neurologists. There's only 500 in the world, and I think there's only one other besides me in the state of South Carolina. So it's really a niche market, and or not a niche market. It's really a niche. Yeah. And I also have a background in metabolic disorders, vestibular disorders, of balance stuff, movement disorders. So the way we kind of came up with our clinic name, the Integrated Health, is we kind of bring in all aspects of health and service to our community and our clinic, and kind of help everybody using different tools.
Okay, so someone has a weight loss goal for the new year, New Year's resolutions. We've been talking about it all the time, and they want to come get in better health, because when you think of the spine, we think of it somewhat as you know, you could think of it as an irrigation system where all the parts need to be open and functioning properly in order to feed the rest of the peripherals of your body.
Exactly.
And so a person who wants to just get an overall health and wellness and lose weight at the same time, how should they approach coming to someone like you?
Oh, okay. Well, that's a great question. Actually, what we'll do is for WLCN, we'll extend an offer, a free consultation if you come into the clinic, mention WLCN, and you can come in and we'll sit down with you. We'll go over some metabolic testing. We'll do some assessments. We'll make sure the mind and body connection has integrity, is connected. And if it's not anywhere in those conditions, in that situation, we'll actually move forward with the care plan. Maybe we can help you, maybe we can't, but we'll let you know for sure if we can help you or not. And you know, like I said, one of the most valuable things in diagnosing a thyroid problem is the blood work. So we'll tell you what blood work you can get, and we'll analyze it for you, and as all that part of the consultation. So.
Okay. Great. Let's talk about some contact information because folks want to be able to find you. You're in Mount Pleasant. Give us the address, if you will.
874 Whipple Road, Suite 200. It's right on Whipple Road between Long Point and Mathis Ferry.
Okay.
And we have a website, too, where you can actually go online and you can get directions. It's www.neurologichealth.com. And on there, there's a map. You could put in your address. It'll give you driving directions. It'll tell you a little bit about me, what we could do, who we can help, how we help you. A lot of information on the site. It'll probably take you a couple hours to go through all of it, but you can find out a lot about yourself and a lot about me on there. Great
info. And a phone number for those who don't necessarily want to go to the internet.
Oh, yeah. 843-882-LIFE, L-I-F-E 5433. So make it easy to remember.
Easy to remember. All right, Dr. Matt Antonucci, we're talking about the thyroid. Anything else that you think folks should take away from this segment if they have some weight loss goals and they're not sure that the dieting and exercise is currently matching up with their performance that they're seeing?
Yeah, well, I mean, dieting and exercise is always the first place to start because a lot of times what I see with these patients is that it's not really a problem with them, it's a problem with their lifestyle. So if you really exhausted every option where you've gotten a personal trainer, you've gotten dietary modifications, lifestyle modifications, you're managing your stress, and all of that is not working, I'm probably the person for you. And you know, we could definitely help you, but always try those lifestyle changes first because we want to take the least invasive method first, which would be just changing your lifestyle, and then working our way towards maybe chiropractic, neurology, metabolics, then drugs, then surgery if needed at the end.
Okay, great advice, Dr. Matt Antonucci. Go see him in Mount Pleasant. Thanks a lot for being on the show.
Thanks for having me.
As well. Hey, and this is on Port City Live.